clinic in western Nebraska where we treat adults and adolescents with severe mental illness. Now, I know this will be no surprise to you, but we have a national crisis in our hands when it comes to behavioral health care. 65 million Americans suffer from a diagnosable mental health illness. That is 1 in 4. Yet we have less than half of the psychiatric specialists that we need to meet that demand. And when you look at psychiatrists, they are the second oldest practicing group of MDs, nearing retirement, and their numbers continue to dwindle. So how are we solving this problem? Well, we remove those geographical barriers through technology, telehealth. We have a national network of board-certified psychiatric mental health nurse practitioners who, over our telehealth platform, are able to connect with their patients wherever they may be. We currently operate in full practice states, so our nurse practitioners are able to diagnose, treat, and prescribe without MD supervision. Now, before I talk more about Encounter, I would like to give just a broad overview of telehealth in general. Now, it clearly improves access to care by removing those geographical barriers I mentioned earlier. It also reduces costs. We have a very large underserved community here in this state as well as throughout the country, where there are very few healthcare providers and practically no specialists. We really need to use telehealth to overcome these difficulties. And there are 4 main technologies or applications for telehealth today. Video conferencing, which is what we use in behavioral health care, store and forward, mHealth, mobile health, and remote patient monitoring. Video conferencing, as I mentioned, for behavioral health care has shown great efficacy for the delivery of care in that specialty area. Store and forward is really delivery of medical data from one provider to another. Dermatology would be a good example of this. Say an image of a skin condition would be sent to a specialist across the country.